Hi, so what should be the patient position which is optimal for intubating a critically ill patient or a acutely ill patient in the emergency department? So traditionally the supine position was used. The patient's head and neck were kept in a position known as the sniffing position, in which the neck is slightly flexed above the torso and the head is slightly extended, kept by keeping a small pillow below the occiput. However, the patient remained supine. Recently, however, there is a increased interest in the ramp position, or as we call head up position, as you can see in this picture. So in this position, patient's torso is elevated above the patient's chest, and abdomen is elevated above the patient's lower part of body by an angle of anything between 20 to 45 degrees. Different angles have been used in different studies. However, the head and the neck are generally kept over the edge of the bed so that they are in a position like the sniffing position, and the external auditory meatus is in line with the sternal notch to improve the laryngoscopic view even in head up position. But why this position? The reason being, patient generally who is critically ill, who is having respiratory distress, which is the most common indication for intubation, is generally lying in this position already. You just have to lift them up above the edge of the bed to give this position. Second, this position as compared to the supine position will lead to less deoxygenation, less decrease in the functional residual capacity. Third, this position will also lead to less risk of aspiration. This was hypothesized and tested in many observational trials, and the results were great. The author found that this led to less time to intubation, good first pass rate, good Cormac-Lehan grades, and also less risk of difficult intubation, which was a main concern in doing intubation in this position. However, then a randomized control trial by the name of checkup trial, which was a multi-center trial, was published, which showed that the ramp up position lead to worst first pass rate, more difficult intubation, and even more incidence of deoxygenation or fall in SpO2 during intubation over the supine position. So we don't clearly know where the evidence go as compared to as regards to which is the best and optimal position for intubating a critically ill patient. However, as multiple observational trials support the ramp up position, the Society of Critical Care Medicine guidelines suggest use of the head and torso inclined, that is semi-Fowler position during rapid sequence intubation. However, this is a conditional recommendation and the quality of evidence is very low. They also state that snipping position should be combined if possible with the head up position or semi-Fowler position, but the final choice should depend upon the operator, his experience of doing intubation in head up or supine position, and his preference. And this position should be avoided in trauma patient or when spine injury is suspected. Thank you.